I think became interested in medicine a long time ago, had members of the family who were in the field, so I got exposure, and it became, I think, apparent that medicine combined both science and service, and that's what intrigued me. And then from there, cardiology specifically was fascinating to me, not only just because I was fascinated by the heart, but because you had the opportunity to take care of real urgent and emergent issues like a heart attack, but also manage things chronically, because most of these conditions don't arise overnight. Then cardiovascular genomics seem to combine all of those things, where it's a rapidly developing field, and you have the ability then, because it's genetic risk that you're oftentimes you're basically born with, you technically have the ability then to capture that risk very early on and make a difference in a person's trajectory to hopefully even avoid some of the really catastrophic outcomes that can occur. First is, as with any patient coming in, I think that the key from my perspective is we listen, and listen very carefully, because whether it's cardiology conditions at large or even genetic conditions, patients oftentimes know more than they think. That also allows us to really personalize the care, and that isn't just based on their genetic background, but it's based on their particular circumstances, their priorities, what their family structure is like, and so forth, because I think we really need to tailor the plan to them. But in our clinics, we are typically trying to, when possible, not only have a visit with the MD physician, but when possible, seeing a genetic counselor as well. So it can oftentimes be a paired visit where you're seeing one after the other, so that there's overall counseling about what genetics is and what genetic risk entails, how it affects the individual and the family, as well as then the specific game plan for what testing are we going to pursue, and then what in any way how might that actually impact the overall care for that person with regards to cardiac risk or an existing cardiac condition. Genetics is one piece of the pie. It's an important one. That also means that the other pieces of the pie, many of which are modifiable, can then really alter the trajectory of someone who even has known genetic risks. And if we're able to provide an answer as to why, not just what's happening, but why that might be happening, then that's very empowering for them, we think,